Hello, everyone. I'm Didier Aswad. I'm principal scientist at University of Montreal Hospital Center here in Montreal. Also chief of staff of Department of Psychiatry at the CHUM, as well as an associate professor within the Department of Psychiatry and Addictology at Université de Montréal. Again, a huge pleasure for me to be with you today. I'm actually quite sorry not to be able to be present in Dubai and have the chance to see you all in person and of course visit that wonderful city. But again, a pleasure for me to be here virtually with you and talk about actually a subject, of course, that is of I think high importance for society and of course a professional passion of mine for the last few years. So just before starting, actually, would like to declare some conflict of interest. Actually, as you see on the screen, I will receive a study medication for a trial from Tetra Biopharma for a trial that is actually funded by a public organization here in Canada and in Quebec, which is the Ministry of Health and Social Services. And also in the last few years, I've received a number of grants and contracts from public and government agencies, actually to consult as an expert on various issues related to cannabis addiction and also mental health. And so today I'll talk a little bit about this project that we started a few years ago here in Montreal, but that became a pan-Canadian project, which is really basically a number of studies which try to increase and improve the available intervention for cannabis use in youth with psychosis. And again, just before really diving into the heart of this presentation, we really want to say that the goal here is, and the premise of that project is clearly not to try to be overly dramatic or overstate actually the negative effect of cannabis. We all know that in the general population, as well as in people with mental health, there is a good number of people who would actually use cannabis without experiencing necessarily negative consequences of that substance. That being said, we also know that statistically speaking, and when we look at epidemiological studies, that the use of cannabis in youth with psychosis is associated with a number of negative outcomes, which could be, of course, the increased risk of hospitalization, also the increased risk for youth to experience sustained psychotic symptoms, even in the context of adequate antipsychotic treatment, for example. And all that being said, also really highlight the fact that we do need effective intervention to address cannabis-related problems in that population. And the good news on one hand is that there is a range of treatment that do exist to address cannabis use in that population, mainly motivational approaches, also cognitive behavioral interventions, for example, relapse prevention treatment, which can be provided individually, but also in group formats. The big problem actually we have is not that these interventions do not exist, is actually that when you look at the data from, for example, in Canada, where we have, I think, quite a strong network of what we call early intervention services, which are basically programs that are specifically designed to address the need of youth with psychosis in terms of treating and improving their mental health, but also helping them, finding back kind of a productive life, going back to work and study and whatnot. And even in that type of well-designed programs, what we see is that there's only a minority of these programs who would actually offer adequate evidence-based treatment for cannabis use. And again, when you try to figure out what's the problem and why we have such a low implementation rate of these evidence-based intervention in these early intervention services for psychosis, I mean, first and foremost, we have to agree on the fact that, I mean, most clinicians and program manager would not wake up in the morning saying to themselves, we will not offer today evidence-based treatment. And there are actually many reasons why it's such a challenge to offer evidence-based treatment for youth with psychosis who use cannabis. And among these reasons, first, you have to remember that these programs are super well designed. There's a wealth of services that are offered, but that also put a lot of pressure on clinicians that on their plate have to offer a variety of intervention to treat mental health, but also help you to go back to school, go back to work, improve the relationship with family and whatnot. So adding on top of all that intervention to address cannabis use is quite a challenge. Another issue that we live here in Canada, but also reported elsewhere in the world, that there's some turnover in terms of staffing in these clinics. And of course, it's very difficult to sustain adequate expertise and training among clinicians who work in these clinics. And there's new clinicians coming, and then they have to be trained again. And there's like really high and lows in the ability of these programs to provide evidence-based intervention for psychosis. There's, of course, sometimes problems in regarding resources, some programs not being sufficiently funded to be able to provide that type of intervention. And I would say, and I will finish by that, one of the main barrier is actually the fact that all our intervention for cannabis use in youth with psychosis at this time are really focused on abstinence and supporting youth to decrease their cannabis use. And when you look at data, but also report from clinicians, but also patients themselves, is that there is a good number, if not the majority, of youth with psychosis who actually don't want to stop or decrease their cannabis use. And that subpopulation, which are quite numerous, actually, we don't have much to offer them at this time. Which is why we decided, our research group, to try to find solution to really improve intervention for cannabis use in youth with early psychosis. And when we were kind of trying to find solution to address these gaps, one thing was that actually what we noticed is that we do have a number of interventions for people who are substance users who don't necessarily at first sight or for a certain period of time don't want to stop or decrease their use. And there are a number of harm reduction intervention that have been developed for other substances that can really be useful, if not in the short term to decrease substance use, to truly decrease the burden of substance use and addiction on these people. And the other part of the solution that we identify was the fact that actually there's been a growing use of technology and mobile health intervention to basically try to improve access, and also I would say a sustained quality in the type of intervention that we can provide to people, including people who have mental health problem. And while we don't have that many data supporting the use of mobile health intervention in youth with psychosis, especially for cannabis use, there are a number of data suggesting actually that this is a form of a mode of administration for intervention that is acceptable in that population. And when you look at data of intervention using technology among cannabis users who don't necessarily have psychosis, data seems to show that this is a promising type of intervention. And all in all, what we wanted to do here is to try to provide kind of a wider spectrum of intervention, not only to promote abstinence or decreased use, but also intervention that would allow to reduce harm in cannabis users with psychosis who are not necessarily ready to stop their use, using technology to really be able to improve intake and access to that type of evidence-based intervention. And so that's when we started to develop the two apps, actually two intervention, I Can Change and Champs, which I will talk about in a minute, in partnership with Acufene Studio, which have been a fantastic actually partner, really, as you will see, develop adapted intervention for youth with psychosis. Of course, these intervention inspired and based on evidence-based approach from, for example, cognitive behavioral therapy and also motivational interviewing, adapted with and for young adult with psychosis. So basically, throughout the process, we had young people with experience of psychosis and cannabis use that were integral part, really, of our research team, and really truly helped to develop an intervention that is adapted to the need of that population, in a really kind of an iterative and collaborative process between researchers, clinicians, but also with people with lived experience. And so I will talk a little bit about the first intervention, which is the CHAMPS intervention, which is, again, a smartphone application, which is really truly designed for youth with psychosis who do not want to stop or decrease their use. Not to say that they will not at some point, but that for a little while, actually, what they're saying is that, no, I don't want to stop or decrease my cannabis use. And so really the objective is to change cannabis use practices, not necessarily solely focusing on decreasing use, but really promoting the use of safer cannabis consumption practices. For example, using safer products, less potent products, using cannabis in a context where it's less risky. For example, avoiding drinking, avoiding driving, and using cannabis at the same time. This intervention, again, in the population which is probably less motivated to really change their cannabis use, we have a relatively, I would say, short intervention with 6 sessions lasting at a maximum like 15 to 20 minutes, often less long than that, with video, written content, talking about craving, talking about the link between psychosis and also cannabis use, and also using the SMART approach to really find a goal and having support to achieve that goal in terms of changing their cannabis use habits, with a number of testimonials, also a number of notification, very positive, kind of always providing positive feedback, really trying to help you to change their cannabis use practices, with a booster session 4 weeks after the end of the intervention, and really with a full strategy to integrate that approach within early intervention services where they provide other intervention for psychosis and whatnot. And then here you see the modules. I will not go into the details of all that, but you see that there's a number of topics, also a number of build-up where we talk a little bit about safe consumption practices, and then it builds up really to helping youth to really find their own objective in terms of changing their cannabis use practices and really helping them achieve that goal. You have here an example of what it looks like. So with the app, it's quite simple. Again, we developed that app with youth with psychosis. So the design was really, at the end, the decision making was very strongly influenced by youth preference. So it's kind of a really fun look, a design that is relatively simple, again, decided per and by youth with psychosis. And again, the chance intervention, while we think will really respond to the need of a significant subgroup of the population of people with psychosis, youth with psychosis, who do not want to stop or decrease their use, there are still a good number of youth that will actually want to stop or decrease their use. And that's why we also develop an intervention for those of them that we really wanted to stop or decrease their use. And this is the I Can Change intervention that you have here. Again, an intervention that is really based on motivational interviewing, relapse prevention, cognitive behavioral approaches, where we really try to basically bring them to come to a point where they can identify their objective in terms of changing their cannabis consumption. It's a full smartphone application. A little longer with up to 20 sessions. It's kind of flexible, so it could be between 11, 12, and 20 sessions, depending on how much of the session and strategies they want to find and test and work on, with 3 booster sessions at the end of the intervention with a number of notifications, and again administered, integrated within early intervention services. And again, you have here the modules of I Can Change. With all the different topics that are covered, really building up to a point where they are finding their own objective, and again working and being supported to develop all kinds of strategies to be able to decrease or stop their cannabis use. We have a number of booster sessions. Again, we're looking at decreasing or stopping their use, so we're looking at more ambitious objective, I would say. That's why also we're looking here at a 3 booster session after the end of the intervention to really solidify all the content that they've learned over the course of the intervention. And that's how it looks like. Again, designed with and by youth with psychosis. So again, kind of a very friendly design, simple, colorful kind of application, which is relatively easy to navigate. There is a number of kind of add-on features, such as the journal where they can, how much they spend on cannabis use. There's a lot of positive feedback as you see on this application. Of course, we didn't want to develop these interventions and not test them. Again, there's all kind of phenomenon that you can see when you try to change behaviors that can be quite complex. And of course, we want to make sure that the intervention that we develop will be useful. So that's why we developed 2 trials to test each of the intervention. The first one, again, a trial where we will test in 100 young adults, a randomized control trial where we'll test the acceptability and also the feasibility. And as you see, a number of Canadian cities and sites in Montreal, Quebec City, Halifax, and Calgary. And the same, another trial for I Can Change. Well, we'll do pretty much the same. Well, we'll test, again, it's a randomized control trial. Well, we'll test the intervention, mainly looking at the acceptability and feasibility, gathering some data on early data and preliminary data on the efficacy of these interventions. And overall, with the goal that we think that these interventions could help tackle cannabis-related problems in people with psychosis, for which there's important gaps. We also think that ultimately using technology could improve access and even potentially cost effectiveness, reducing resources, with always this goal of evaluating what we're doing to make sure that the intervention that we develop are actually useful for that population. And I want to thank the group of investigators, and also you have on the left all team members, students, including Ovidiu Tatar and Stephanie Coronado Montoya, who are 2 PhD students, fantastic students who are working quite hard on those projects. And again, thank you for your attention, and I'll be available with my colleagues for any questions or comments after this talk. Thank you.